Mindfulness is a way of being, a basic human quality of awareness that is cultivated by learning to pay wise attention to whatever is happening in our lives. People who participate in a mindfulness-based stress reduction program learn through their own experience how to take better care of themselves by understanding the interplay of mind and body, allowing for greater access to inner resources for coping, growing, and healing. Mindfulness-based stress reduction, or MBSR, is an approach that combines meditation, dialogue, reflective inquiry, and mindful yoga and movement as means of assisting participants to work more effectively with stress, pain, and illness, as well as the challenges of life in the 21st century.
Last night I did yoga right before I went to bed. And the relaxation of it, and my thoughts go off and I bring them back, my thoughts go off and I bring them back. They just go off all the time, like, you know, just go off and bring them back. And I think about work and I think about my anxiety. My anxiety just does tend to quieten a bit as I go through these exercises. And I go to bed at night so grateful for this quietness because I want to slow down. But I didn't know how.
I feel myself getting tense or whatever, and I just stopped.
Yes.
Breathe, you know, and then I observed, like, you know, that whole STOP thing there, and then I just said, I'm gonna be late, so what? Deal with it, you know, and I'm usually, you know, I'm definitely A, and I gotta be there, you know.
So what did you notice at that point?
I was relaxed. I mean, I wasn't tense anymore. I took a big deep breath and just, okay, so I'm gonna be late. Big deal.
MBSR is based on a form of meditation originally out of the Buddhist tradition, having to do with this capacity to pay attention and to actually refine our capacity to pay attention.
Mindfulness is like a deeply embodied experience of wakefulness, and we call that, in common parlance, awareness. And we only are alive in one moment, and that's this one, now.
It's a deep engagement with the vitality of the moment and the appreciation of life. And all of this is done both alone and as a group, so that it has the sense of the community learning to it.
In the MBSR classes, you know, we get a whole bunch of people together and people begin to talk about like what's really going on. And there's a great relief because like people realize like I'm not alone with my anxiety or my depression or feeling overwhelmed or you know, the whole plethora of our human condition. And so I think there's a breath of fresh air of people really wanting to have like a meaningful encounter with another human being. And
it's also utilizing the latest in neuroscience discoveries about something called neuroplasticity. And neuroplasticity is essentially this idea that the brain can be shaped by our experience. So MBSR is also, because it's repetitive, because people practice when they're in class. They practice the meditation methods when they're at home. They practice them in their everyday lives, is that there's a kind of mental muscle being built, if you will, that has real life implications in terms of you might actually handle situations in your life differently. The things that used to stress you out might not stress you in the same way.
I started talking to physicians at UMass, asking them questions like, well, of all your patients, what percentage of them would you say you help? And again, remember, this is now 1979. And I was completely astonished by their responses. They said, well, maybe 20%, 15%. And I said, well, what happens to the others? They said, well, some get better on their own, and the rest. But what if you sent your patients to a place where, like, we could take that time and help them to tap into deep inner resources that they have simply by virtue of being human? So I wrote out a 4 or 5 page proposal, and I directed it to the ambulatory care department in the hospital. And I said, I'll do this 2 days a week for virtually no money. I mean, you know, just like pittance. And they said yes to it. We'll try it.
Scientific research has always been the cornerstone of the work of the Stress Reduction Clinic and the Center for Mindfulness. It is through rigorous clinical and basic science research that MBSR and other mindfulness-based interventions have been shown to be effective and useful to people from all walks of life.
We would assess people before on various measures and then assess them afterwards. The research then went to a much higher level of randomized clinical trials to try to really discern in a much more stringent way what was going on with these people, say at the level of the biology, at the level of brain function, at the level of the immune system.
We wouldn't be here 30 years later if it wasn't for the science, because you wouldn't have anything to talk about. You could just say, well, people think it's a good idea and they like it.
Head and neck balanced on the shoulders, allowing the eyes to close and just tuning into the breath. And a sense of your body as a whole, just sitting here.
How do your patients, your new patients, react when you mention to them the word and the idea of meditation?
Well, we had no idea, and this had never been tried before in a medical center, whether people, mainstream Americans, this is not Berkeley, would go for a clinic, the foundation of which was intensive training in meditative disciplines. They are being sent by their doctors for all sorts of very real problems, and they're not at all interested in yoga or swamis or gurus or Zen masters or enlightenment. They're suffering, and they are coming because they want some relief from their suffering. And you watch the sensations come and go, and very often they will change. Noticing that you can uncouple the sensations from your thoughts about them. And then it turns out there's inner stillness and peace right within some of the most difficult life situations.
See if you can stay with the breath and just let the pain do whatever it does. Stay on top of it by floating on the breath.
We got a lot of telephone calls from both physicians and patients with serious, horrific AIDS, bone cancer, all sorts of things. And they would say, I don't know what it was that I saw on TV, but whatever it is, I want it. And so that was one certain quantum leap in, the sort of secret was out, the cat was out of the bag.